Greetings and a warm welcome to all our participants. Today marks the beginning of an exciting journey as we gather here for Mastering Timely Payments, where we delve into the depths of strategy around effective collection. I am Peter Hawes, your host for this enriching session, and I'm truly thrilled to have each and every one of you with us. My background into timely payments and healthcare came when I first joined long-term care and rehabilitation as an administrator, and timely payments became a way of life. Now, before we begin, I understand that there will be questions that arise during the webinar from many of you. However, to ensure all questions are answered promptly, we ask that you please either write them down or remember the questions for later. During the last few minutes of the hour that we've set aside some time specifically for Q&A, and hopefully I answer the questions along the way. So let's get started. The next 30 minutes or so, we are going to explore understanding why timely payments go beyond financial transactions, playing a pivotal role in the stability of your business, identifying common obstacles in the payment process, learning to establish a system that fosters prompt payments. We're going to look at best practices and patient statements that are visually appealing. And we're going to delve into leveraging automation to streamline the payment collection process. So we'll be unraveling insights and sharing valuable perspectives. So whether you're a seasoned professional seeking to enhance your expertise or a curious mind eager to discover new horizons, you are in the right place. So get ready for an engaging and thought-provoking experience as we embark on this learning journey together. We'll start with this first screen. 83% of physicians report slow patient payments as their greatest payment challenge. If you are in agreement with this, if this is something that's happening to your practice, go ahead and nod. While I can't see the nods, I'm assuming most of us are currently nodding. Patient delinquency and non-payment can pose significant challenges for our medical practice. And as you see, most of us are saying that this is our greatest payment challenge. So patients may fail to pay their bills due to a variety of reasons, and practices that don't have effective billing and collections processes in place may struggle to follow up with patients and resolve payment issues promptly. So let's get into some of these payment obstacles. So we'll look at lack of payment options, financial stress, confusing bills, and missed or forgotten bills. And how do we navigate through these challenges? So number one, payment options. In 2021, when patients were asked all the ways they paid their medical bills over the last 12 months, this is how they answered. Now, the even distribution across each option underscores the necessity for multiple payment solutions. Now, if you're like me and you're looking at the screen, you're adding all this up and saying, oh, that's more than 100%. That's true. That's because it said list all of the ways you've paid your medical bills over the last 12 months. So each patient could have used multiple modalities or avenues. If we're looking at the patient, these preferences for multiple payment options in healthcare are driven by what? A desire for financial flexibility, convenience, security. Ultimately, addressing these preferences not only meets the diverse needs of patients, but also enhances the overall satisfaction and accessibility of healthcare services. And you'll notice these are all over the map. 44% same day in office, 23% using a mobile app, 31% additional ways online, 32% by mail, all over the place. Now, medical expenses and debt is unlike any other kind because it's often not something people knowingly take on. We don't get to choose or predict when we get sick, but it's almost inevitable that unexpected medical expenses will come up. And let's look at the statistic there. 63% of us are unable to cover a $500 emergency expense. Why? Because it's an emergency expense. It's not budgeted. We're making our car payments, we're making our mortgage payments, but we're not expecting this emergency medical bill. So keeping this in mind and providing payment options, such as payment plans that are flexible for both your patient's needs and your practice's needs, is key in collecting payments on time. Payment plans can remove a lot of the financial stress of medical bills, which increases what? How much you get paid. What about bill confusion? 71% of our patients say that they're confused by their medical bill. Now, this statistic speaks for itself. The lack of understanding in medical billing is drastic. This confusion is ultimately leading to payment delays or payment abandonment. But there are simple solutions to creating patient literacy in medical billing, and we'll delve into that as we go through this webinar. Missed or forgotten bills. Interesting. Even in the digital age, patients still want to be receiving their bills in the mail. It's important to honor this by continuing to send these paper statements, but it's equally important to fortify them with electronic notices such as email and text. I don't know if that statistic was staggering to anybody, but 74% of our patients still want to receive a paper statement. There's more to payment delays than just patient road bumps. Practices have their own hardships to tackle. The healthcare industry is no stranger to the phenomenon of the Great Resignation. According to MCMA, 73% of medical practices rank staffing still as their biggest post-pandemic challenge. 73%. Since 2020 alone, 18% of healthcare workers have quit their jobs. This puts an increased strain on practices in dealing with the struggle of maintaining adequate staff and the added cost of turnover, along with training new staff. When patient volume is high and staff is stretched thin, practices may struggle to keep up with the demands, and often the efficiency of billing and processing claims is impacted, which in turn impacts the revenue cycle of the practice. Some practices use various software platforms to streamline and manage their billing process. However, depending on the system's complexity, this can lead to errors and delays in getting invoices out the door in a timely manner. Errors that occur can range from incorrect information being entered into the system, double entries not being caught and corrected before processing, or coding errors that lead to incorrect reimbursements for medical services rendered. Integration between different systems can also ensure the timely sending out of the invoices. For instance, if patient data is stored separately from billing records or practice management software, it may take additional time to get all the relevant information together before an invoice can be sent out. On top of this, any changes or updates that need to be made must be done manually, thus adding more time to the process. So, to limit potential errors and delays, we have two possible solutions. A, you could provide adequate training to teach staff how each platform works, but this will be costly and time-consuming. A better use of resources would be an investment in up-to-date technology capable of integrating all necessary data sources into one location. Or B, consider streamlining processes into a single platform. By consolidating vendors and using a single billing and payment processing platform, you'll experience fewer delays, and necessary checks and balances will also help ensure accuracy regarding patient records and payment processing. Manual processes. Manual billing introduces numerous inefficiencies into the medical process, causing significant delays and errors in medical practices. Attempting to handle patient payments without automated systems can create a bottleneck affecting the entire practice, resulting in increased patient wait times due to long wait lists, unbalanced workflow, and miscommunication between departments. This can bring frustration and dissatisfaction to both the patient and to the practice itself, leading to lower levels of patient satisfaction. The use of automated systems enables practices to reduce wait times while increasing accuracy and efficiency in their operations. Automated systems are designed to optimize the patient payment process by streamlining activities such as processing claims, sending out bills, collecting payments. By automating these tasks with an integrated software platform, companies can provide faster service turnaround times, reduce administrative costs, and improve overall data accuracy. I don't think there's anything on that list that we're not all vying for. So we know what the problems are. How do we get past them? So we start by laying the groundwork here. The answer to the problem is to offer all these payment options, which can be daunting when you're doing it on your own. But that's where billing solutions like BillFlash come in. So let's look at the slide. 80% of patients would consider switching providers for more convenient payment options. Okay, you can offer all the payment options through BillFlash that your patients are seeking without managing the back end or juggling different software. Instead, have everything in one place. You can focus on the patient care while drastically improving your patient payment experience. And just as a side note, 80% of patients, this actually increases to 84% if we're talking about millennials. So when we're talking about loyalty, why are they coming back to the doctor? Generally, what people will say about the practice is they remember their last experience. And the last experience is generally not the consultation or the care that was provided, but the payment experience. Are we providing the modalities that they need? And if we go back to one of those first slides that we saw and all the different ways that people like to pay, it's really something to consider. 57% are looking for a payment plan prior to or at the time of service. When implementing payment plans, a great practice is to provide the option of a payment plan up front. Catholic Health, as an example, trained their financial clearance teams to offer payment plans to patients pre-service. What did this do? This change led to a 102% increase in installment payments made toward an outstanding balance and a 50% increase in the number of payment plans created. So if we go back to the 63% of us can't afford a $500 emergency medical treatment, then having an option to break it into payments and installments is huge. In addition to these payment plans, offering discounts if patients pay in full is also a great option. Now, pre-visit billing. I don't generally like to read everything that's on the screen, but I think this one's important. What is pre-visit billing? Easily collecting fees pre-visit eliminates the need and expenses to bill and the hassles to get paid post-visit. With BillFlash, you can simply give your patient a unique link with the pre-visit charge, which they can quickly pay online. Pre-visit billing in medical practices offers a range of benefits, from streamlining administrative processes and enhancing the overall patient experience. First off, it promotes financial transparency by providing patients with clear information about anticipated costs before their appointment. This transparency empowers patients to plan and budget for their healthcare expenses, reducing the likelihood of surprises and facilitating more informed decision-making. Additionally, pre-visit billing allows medical practices to verify insurance information in advance, minimizing billing errors and potential claim rejections. From an administrative perspective, it improves the efficiency of billing processes, reduces the time and resources spent on post-visit billing, and accelerates revenue collection. Ultimately, patients appreciate the convenience of settling financial matters before their appointments, contributing to a smoother check-in process and fostering positive patient-provider relationships. Effective communication plays a critical role in fostering trust between patients and healthcare providers. Patients want to feel heard and understood, and they need to be able to trust that their healthcare provider has their best interests at heart. This requires healthcare providers to use clear, simple language, actively listen to patients, and provide all necessary information and explanations concerning their treatment and payment options. And as you can see from the screen, virtually all of our patients have said this is what they're looking for. Okay, so what about using or leveraging innovative statement designs to pick up the payment flow? Patients appreciate straightforward communication. By presenting information in easily digestible formats, providers can ensure patients understand their healthcare expenses without confusion. Using layman's terms and avoiding complex legal or technical terms or legal jargon helps patients understand their billing responsibilities. Clear patient statements also contribute to better financial care for patients by making healthcare charges easy to understand. So, to ensure accessibility to a diverse audience, use language that is understandable to all patients, irrespective of their medical expertise. So what are some things we can do? Simplify complicated medical wording for better patient understanding. You see the example on the screen. Liver disease rather than hepatic disease. Use clear headings and bullet points. So clarity and simplicity, number one. Number two is detailed and accurate breakdown of charges. An itemized statement that breaks down charges in detail is important for transparency. The statement should provide an outline of services provided as well as related costs. Itemized billing gives patients clear insight into what they are paying for. It helps patients distinguish insurance-covered services from out-of-pocket expenses. So what can we do? List itemized charges in chronological order by date of service, helpful. Provide explanatory details of each healthcare service provided. Display charge amounts for every item and separate insurance-covered costs versus patient responsibility. Multiple payment options and easy access. There should be clear instructions so patients will feel at ease when utilizing their chosen payment option. If using an online payment portal, consider including a QR code on the statement to quickly direct patients to the portal. This is a feature BillFlash offers for free on all our mailed statements. Providing flexible options improves the likelihood of fast payment. The QR code, by the way, has taken off like hotcakes. People are using it left and right. What are some other things we can do? Well, we can include the website URL, phone number, and mailing address for payments. We can incorporate step-by-step instructions for online, phone, and mail-in payments. We can offer multiple language options for statements to fulfill diverse patient needs. What about timely and consistent delivery? Patient statements should always be delivered on time to accelerate collection. Consistent billing cycles contribute to better financial preparedness, as well as help patients anticipate and manage their healthcare expenses. Quick delivery can also help reduce uncertainty and open balances. So what are some of these things that we can do? Well, it's best to establish a regular statement schedule every month. And I understand we already talked about 73% of us saying we still have staff shortages. And we have seen a lot of irregularity in statement schedules because of that. Instead of monthly, it's a month here and then it's a 3-month in between. And it really affects the collection cycle. Another option, if we have that possibility, is to send statements out within 5 business days after insurance claim adjudication. So at BillFlash, we mail them the next business day or send them digitally same day. We need to make electronic statements available immediately after claim processing. And we should always set up automated text and email notices on e-statements ready to view. Best practice number 5, personalization and engagement. Personalized statements improve clarity and strengthen patient engagement. Statements should address patients by name and include service details relevant to their care. Personalization also raises perceived statement value, capturing a patient's attention right away. You'll notice the different colors. Red. Well, when do we generally send out red? So if we're looking at the aging of an account, red will come in depending on the practice, but generally at the 90-day mark. And it's a, hello, you have a past due invoice sort of color. When you look at these 3, red, green, or blue, if you had to guess what was the most popular color, what would you go with? Believe it or not, it's blue. Blue fits in with a lot of the practice's logos, and it's just a good feel. And as mentioned, it leads to better engagement. So as a reminder, address statements to individual patients by first and last name, reference specific services, dates, providers from appointments, maintain a consistent statement style and tone for every patient, add engaging color, and you can include custom messaging. For example, maybe you want to throw on there that not just the past due that you see on here, but maybe you have holiday hours coming up. It's another way to communicate with your patient base. So we've leveraged the statement. How do we leverage automation? A great way to make paying even easier is to make it effortless with automatic payments. Today, people set up automatic payments for most of their utilities and services. Patients are getting out of the habit of receiving invoices which need to be paid manually. Just think for a moment how many of your own payments are set up on auto pay. Your cell phones, your cars, your utilities, your mortgage, your rent. By setting up automatic payments, patients can avoid missing payments without the effort of paying every bill individually. They're also eliminating the risk of going to collections or taking on an interest payments. You can even incentivize patients to use auto pay with a small discount on their bills when they sign up. Just be sure to check with participating insurance carriers, as some have language that prohibits discounts. But knowing that 40%, almost half of our consumers, our patients, are paying their bills with automatic payments. It's good insight to have. Automatic payments have become standard practice, and it's being embraced by more and more businesses every day. Implementing automated payments for your practice offers your patients the convenience they've come to appreciate when it comes to managing their bills. We're meeting them at their level. They can determine which payments are automated and how much is withdrawn each month. Automated payments provide practices with a simple way to ensure they are paid in full and paid on time. BillFlash's auto-pay feature allows practices to automate the process of collecting payments for patient remainder balances. Incentives and penalties to increase payment speed. Encouraging patients to pay their bills in full can be a beneficial strategy for both healthcare providers and patients alike. By offering a small discount as an incentive for settling the entire bill promptly, providers can promote financial responsibility and streamline the revenue cycle. However, it's crucial for healthcare providers to exercise caution and, as mentioned, review contractual agreements with participating insurance carriers to ensure compliance with any regulations or restrictions related to offering discounts. Overall, incentivizing payment methods like full payments can contribute to improved financial efficiency for healthcare providers while offering added convenience and savings for patients. What are we here talking about today? We're here talking about increasing the speed to getting paid. Now, does offering a discount as small as 3 to 5% get us there? Well, it's interesting. I'm the VP of sales here. I've been in sales for a lot of years. And a term that we like to use a lot is perceived value or perceived benefit. Because one of the questions you can be asking yourself is, well, what's the big deal? Why would I take 3% off? If it's a $100 outstanding balance and I take $3 off, why would the patient be more inclined to pay? Again, when you look at it that way, yeah, $3, but we could look at it the reverse, which is why wouldn't we be willing to take off $3 of the 100 if it's going to get us paid? If the patient has this perceived benefit or value for paying in full, and it's only the 3 to 5%, then we both win. They feel like they got something out of the deal. They feel like they were discounted and there was a negotiation piece and they won, like buying a car, I guess. And then the practice wins because we got paid in full. If incentives, reminders, and payment plans aren't working, the possibility of reporting a patient to the credit bureau needs to be considered. The good news is that as of July 1st, 2022, paid medical collection debt will no longer be included on consumer credit reports. This is beneficial for all parties involved, and it creates greater incentive to pay bills even after they've been reported. Although it's not the ideal solution, we don't want to send people to collections, but that doesn't negate the importance of having a process in place for overdue bills. BillFlash offers 3 levels of collections communication styles, so you can choose what's right for your practice, how you want to communicate with your patients. You can set it to low, which is we send reminders that the debt is unpaid. You can set it to medium, which will advise the possibility of the debt being reported if the remainder is left unpaid. Or you can set it to high, which communicates that the debt will be reported and we will report the debt to credit bureaus. Another change to note is that the time period before unpaid medical debt will appear on the consumer credit report will increase from 6 months to 12 months. And finally, Equifax, Experian, TransUnion, they will also no longer include medical debt under $500 on credit reports. So it's important to stay up to date with these changes as they affect the way that we collect and report. They ultimately affect our strategy on how we want to make the outreach. So what about payment reminders? When patients are receiving and paying bills through different channels, payment reminders become essential. Implementing a multi-channel approach to payment reminders is a strong strategic move. This approach acknowledges the different ways patients like to view and pay their bills. As you'll see on the screen, reiterated, 74% of patients prefer to receive their medical bills by mail. We will always advise you to send a paper statement. It is still the #1 legal way of advising somebody that there is a past due amount or an owed amount. Combining traditional mailed statements with digital notifications not only caters to varying communication preferences, but also reinforces the importance of clear and accessible financial information. It also ensures that patients receive timely and consistent reminders, reducing the likelihood of oversights in bill payments. So I'm one of the 74%. I like to receive the paper statement. What do I do after I receive the paper statement? I set it aside. Oh yeah, here's the doctor's bill. I check it, I verify, hey, look, it looks like insurance covered what they needed to. Here's what I owe. But then I set it aside, and it's not generally until I get that electronic reminder that, that's right, I need to pay the bill. By embracing both physical and digital avenues for communication, healthcare providers can effectively engage with a broad spectrum of patients, enhancing overall transparency and facilitating a smoother and more responsive billing process. So I hope that my personal story helps put this kind of in the mind, because when you first see it and it says, hey, 74% want paper, but 84% still want to pay online, maybe it wasn't coming together and making sense. But once we see that this is how the majority of people work, they like to be reminded, then it makes more sense. And we can move on to understanding that industry data reflects sending electronic statements in addition to paper typically cuts the average days to payment from 20 to 9, faster payments, and boosts the percentage of full payments rendered from 77% to 95%. And for anybody here that manages their practice's cash flow, that 18% of total collection is huge. And it comes from combining, again, the electronic statements with the paper statements. If you're unsure about adding digital notices before, or if you were unsure about adding them before, let this right here be your sign that mailed statements and electronic notices are the best team for getting you paid more and faster. As we conclude today's webinar, I'd like to take a moment to emphasize the transformative value that BillFlash services bring to your medical practice. In an industry where efficiency and reliability are paramount, BillFlash stands out as a beacon of innovation. Our cutting-edge solutions are designed to streamline your billing processes, ensuring that they are not just faster, but also more accurate and secure. We understand the unique challenges faced by medical professionals, and our commitment to continuous innovation means that we are always ahead, providing you with tools that not only meet your current needs, but also anticipate the future trends in healthcare management. We've been doing this for 20 years. With BillFlash, you're not just choosing a service, you're embracing a partnership that grows with your practice, enhances your patient satisfaction, and ultimately boosts your bottom line. I want to express my gratitude to each and every one of you for joining us. It has been an enriching experience, sharing insights, knowledge, and ideas. I hope you found value in the discussion and presentation. Networking and collaboration can be powerful tools on your path to success. We are here at BillFlash to assist you in your endeavors. You can feel free to schedule a demo today at billflash.com. Now, just want to thank you once again for being a part of today's webinar. Your commitment to learning and development is commendable, and I wish you all the best on your journey ahead. Stay inspired, stay motivated, and keep pushing the boundaries of what you can achieve. Till we meet again, take care and farewell.